So today we're reporting 83 new community cases since 9 a.m. yesterday, taking our total number of confirmed cases associated with the current Auckland community outbreak to 511. 82 of the new cases are in Auckland, one is in Wellington. The latter is a close contact of an existing case and was in isolation with no exposure in the community while infectious. There are also 2 new cases to report in recent returnees in managed isolation. So the total number of community cases in Auckland is now 496, and it is 15 in Wellington. 453 of the cases to date are epidemiologically linked, with the remaining 58 links being established epidemiologically and through our ongoing genome sequencing. There are currently 7 subclasses identified within the outbreak, the 2 largest being the ones we've talked about previously, the Birkdale Social Network, associated with Case A, that has 68 confirmed cases now, and the Mangere Church cluster that has 237 confirmed cases. All of the remaining clusters have fewer than 20 people associated with them. Now, at the moment, we have 34 people in hospital as a result of this community outbreak. 32 are in a stable condition on a ward, while 2 are in a stable condition in intensive care. 3 of those cases are in North Shore Hospital, 18 in Middlemore Hospital, 13 in Auckland City Hospital, while 1 is in Wellington Regional Hospital. Locations of interest were 475 as at 9 o'clock this morning, and additional locations that continue to be identified will be put up on our website. So please do keep checking regularly. We are now removing locations of interest from the website after 18 days, because after that time we're not concerned about ongoing transmission or public health risk. Yesterday was another big day on the testing front, with 23,139 swabs processed. That seems like a small number, but it is as high as the biggest days we had last August in our outbreak.
More than 3/4 of our cases yesterday were contacts of known cases. And if we break that down further, over half of our total cases yesterday were in fact household cases. This once again shows how infectious Delta is. Only 2 were considered to be infectious before level 4 restrictions came into force, which is helpful. We know that limits down the amount of contact our new cases are having with others. A total of 25 people had exposure events outside of the household. We've been advised to date that the Ministry of Health analysis is showing that these are generally essential work sites and tend not to be customer-facing sites. We've asked for further analysis as to the nature of these workplaces so we can assess whether our level 4 rules on who is operating is being adhered to, and whether our public health protocols for those businesses that are operating are fit for purpose. As you will have heard me say at the end of last week, we have a small number of workplaces that are operating at level 4 that have seen transmission within staff. I'm advised that it's 4 in total to date. Now, this may not be a problem with the rules, say, on the factory floor, but what is happening perhaps before and after shifts or even during break times. We're looking at all of this in more detail. If we need to tighten up our restrictions further, we will. You'll also recall that last week we talked about locations of interest generally and the number that have actually produced cases. You'll see that we have now more than 450 sites. And these have started slowing down dramatically as a result of the lockdown and people staying at home. But of these locations, we can share that we believe transmission occurred at 21 of them. For the most part, that transmission has been relatively limited. But our ask would be that all contacts, no matter what the location of interest, continue to follow the public health advice. And many will be coming up, for instance, for a day 12 test. As you'll know, there are 2 particular sites where we know a large number of cases have come from. Well, one, as we all know, is the event attached to the Assembly of God. The other we'd like people to be especially mindful of is AUT. This is a difficult location to contact trace, but we do know it has resulted in 20 cases thus far. Please, if you're connected to AUT, look up the locations of interest for the site and follow the public health advice. And it clearly sets out the different parts of the campus that we're particularly mindful of and we need people to come forward for testing. Having positive cases in our communities, along with the impact of lockdowns, I know can be hugely unsettling. And that uncertainty can impact on everyone's mental health. It's okay to feel overwhelmed, to feel upset, or even to feel frustrated, because this situation is often all of those things. But there are places you can go for support and help, even while you're living with restrictions. The Ministry of Health and Unite Against COVID websites have a great list of free resources. These include tools targeted at young people who may be finding this time challenging, in particular those isolating in hostels or halls of residence. We know, for instance, that early on in the lockdown there was a spike in calls to Youthline. We responded to that spike in calls with an immediate $275,000 of funding for Youthline, a boost to what they usually receive. But we want to make sure all of our services in this area are well supported. So we'll be providing an additional $1 million into existing contracts and services to support our rangatahi, with a particular focus on those in Auckland and Northland. A quick recap on some of the helplines. At any time, anyone can call 1737. It's available 24/7 via free call or text. And Youthline, which you can reach by calling 0800 376 633 or by free texting 234. There is also targeted mental health support available to Pacific communities via a dedicated 0800 number, 0800 Olalele, 0800 652 535. Family violence and sexual violence services are considered essential services and are continuing to operate at level 4. If you feel you're in an unsafe environment, you do not need to stay in your home or in your bubble. I'm going to repeat that. If you are not safe at home, you can leave your bubble. If you feel in danger, call 111. If you or someone you know is in danger and it is not safe to talk, police have the silence solution. Phone 111, and if you do not speak, you'll get the option of pressing 55. You can then listen carefully to the call taker's questions and instructions so they can arrange assistance for you. There is also support in place for those struggling to access food. In addition to the $32 million we invested last year into food banks, food rescue, and community groups that are distributing food to vulnerable people in whānau, yesterday we announced an additional $7 million for food security networks operating at Alert Level 4. The extra funding will help with the distribution of an additional 60,000 food parcels and 10,000 wellbeing packs. If you're unable to afford food, call MSD on 0800 559 009 to see if you are eligible for assistance or to be connected to other forms of assistance that is available. If you're at home isolating or having problems accessing food, you can ask family, friends, neighbours if they can help deliver food for you. Delivery should be contactless and kept local. For those in self-isolation or have no other way to access food, the Student Volunteer Army also has a grocery delivery service. Visit www.shop.sva.org.nz. We continue to support those needing emergency housing during the lockdown also. Since lockdown began on the 18th of August, we've contracted more motel units to cater for people who would otherwise be sleeping rough, and we're closely monitoring this need. You might have heard me mention last week as well, the 3 Auckland Metro DHBs are vaccinating those who are homeless via a range of mechanisms, including Auckland City Missions GP Clinic, a mobile outreach team, and we're working with homeless providers to visit temporary housing sites and provide transport to people in temporary housing to enable them to reach vaccination centres. What I've listed really is just a snapshot of the various supports in place to help everyone get through this period of restrictions as we tackle COVID-19. And I guess I would summarise it as follows. You are not alone. We are all in this together, and support really is just a phone call away. Those key numbers again. For food, MSD, 0800 559 009. Mental health support or counselling, call 1737 or Youthline on 0800 376 633. If you're from the Pacific community and need mental health support, 0800 652 535. Please do make use of these services. They're there to support you.